Good morning, everyone. My name is John Nelson, and we are back with another episode of our Facebook Live Q&A about the COVID-19 vaccines. I'm very excited today to be joined by Dr. Aparna Oltikar, who is with us to talk about the different types of vaccines that are out there that are authorized. So, Dr. Oltikar, tell us a little bit about yourself, and welcome.
Thank you, John. So good morning, everybody, or good afternoon, almost, everybody. So I am currently the Vice President of Medical Affairs at Danbury and New Milford Hospitals, which means that I'm kind of like the chief doctor at both of these hospitals. So I oversee most of the clinical operations from the physician side of things. I am an internal medicine doctor by training, and I currently practice as a hospitalist at Danbury Hospital. And so, you know, over this past year, I've been very entrenched in the COVID care and setting up COVID units, et cetera. So that's a little bit about my background.
Well, welcome to our discussion. We have had a few discussions already, joined by Dr. Brenda Ayers, who's in charge of hospitalists at Vassar Brothers Medical Center a few weeks ago, and last week by Dr. Valerie Cluzet, who talked a little bit about the science. This week we wanted to get into the different types of vaccines. And specifically, there are three that are authorized: Moderna, Pfizer, and Johnson & Johnson. So why don't we just first, let me ask you, like, what are the three types? You know, what do they do? What are their differences? You know, just as much as you can say about that.
Sure. So I think that it's important to understand right now about the vaccines is that they all, one way or another, each of these vaccines, the three that you've mentioned, John, Pfizer, Moderna, and the Johnson & Johnson, which are approved for use in the United States, all work by getting a piece of the coronavirus, specifically the spike protein of the coronavirus, into our body's immune system so that our body's immune systems can develop a protective immune response against that spike protein. Now, how they do that is where the differences lie. Both Pfizer and Moderna use messenger RNA, meaning they use they take RNA from the coronavirus, the RNA which codes for this spike protein, and they put that into a little lipid nanoparticle which gets injected into the skin, whereas the Johnson & Johnson gets that same COVID spike protein material into the body via an adenovirus. So I know I'm using a lot of sort of scientific terms, and the point I want to make is that the mechanisms are very similar. They all have, which is why we sort of see very similar efficacy for all three vaccines. There are some logistical differences between the vaccines. So as most people know, the Pfizer, you get 2 shots. You get the first shot, and then 3 weeks later, you get another shot. For the Moderna, you get a shot, then 4 weeks later, you get another shot. And the Johnson & Johnson vaccine is currently just a single shot. And the reason for these differences is just really how the initial studies were done. And I don't really know all the science behind why some vaccines were developed with a two-shot methodology. But what I can tell you is that once you're done with each of these vaccines, the efficacy of each of them is very comparable.
Okay, and so if we're talking about, these vaccines, and one of the things that you hear out there all the time is this happens so fast, right? I mean, they named it Operation Warp Speed, all these other things. How do you allay someone's concern that this happened really fast and was enough done to study it? What would you say to someone who asked that type of question?
So I think that those are all really valid concerns. And what I would say is that, so I'll tell you that in the hospital last spring, when we first saw COVID in our hospital systems, we accomplished things in the hospital that under normal circumstances would have taken us 6 months or a year to achieve. And the reason we did that is, one, because we had to, there was no option. And
Mhm.
number two, it really became our singular focus. All we were doing is focusing on COVID, and all the other stuff that we normally do in a hospital, the initiatives, the ones that we could, we just sort of stopped doing them for a while. And I think the same thing happened with these pharmaceutical companies that developed the vaccines, is that this was their singular focus. And because there was this absolute need to develop a vaccine, because I think even early on in the pandemic, it was clear that the only way out of the pandemic was to develop a vaccine, everybody stopped doing everything else. And we just prioritized the COVID vaccine. So I think that it's important for people to know that none of the steps were skipped. They were all the normal steps that it takes to approve and ensure that a vaccine is safe. All of those steps were taken, did happen. They just happened at warp speed. They went very,
Yeah.
very quickly. Yeah.
Okay. And so, you talk about the mRNA, which is the Pfizer and the Moderna, and what's there between those and then like the Johnson and Johnson? I'm like, are they, like it sounds to me like, at least from the stuff that I've read, is that while these were developed quickly, it's not like new technology. Like we've been studying or we've been creating these types of vaccines before. It's just, so what is the difference between like an mRNA and the Johnson and Johnson?
So again, so all three of those vaccines are trying to get your body to produce antibodies, which are protective proteins. They're part of our immune system that help us fight infections, towards the coronavirus spike protein. And the spike protein on the coronavirus is the way it attacks cells. It's an intrinsic part of how it attacks our cells. And so whereas the Moderna and the Pfizer vaccines take just a piece of the messenger RNA of the coronavirus and put it in a lipid nanoparticle, and then that gets injected, and then that messenger RNA goes into the immune cells and allows us to develop an immune reaction. The Johnson & Johnson uses an adenovirus, a virus that has been modified, so it's not able to replicate inside the body. Only the nuclear material of the coronavirus that we've intercalated into the adenovirus can replicate. So they're very similar. The differences are minute, and you're absolutely right. Both of these methodologies of vaccine development have been around for a long time, and maybe they haven't been used as much, but there wasn't a compelling need before. But certainly they've been around. They've been used to try to develop vaccines against things like HIV, against things like Ebola. So lots of, this is an ever evolving field, and so I think people just need to know that these are not absolutely new technologies.
Okay, and so you're talking about the creating antibodies, and sometimes those cause what has been termed as side effects, but it's really just kind of like the vaccine's doing what they're supposed to be doing, right? So can you talk a little bit about like what type of things like people experience when they get vaccinated with any vaccine, but especially these?
Sure. So, a lot of times, I think that sometimes it's hard for us to understand that it isn't always the virus that causes certain symptoms. So when somebody has the flu, even in such a case as that, a lot of our symptoms are caused by our own body's inflammatory reaction to the virus. And the same is true for the coronavirus vaccines. The reaction is not caused because we're infected with the virus. The reactions are a result of a very healthy immune response to the vaccine. So a lot of people who get these reactions, and they can range from very mild, like the sore arm, a bit of a headache, body aches, to some people having really terrible symptoms, fevers, chills, feeling like they've been run over by a truck. And it really depends on how exuberant your body's immune reaction to the vaccine is. So in a sense, even though, some people seem to have more serious side effects, meaning they feel lousy for a longer period of time, that may be because their immune systems are so healthy and active that they're doing exactly what it's supposed to be done. And this whole area is very new and evolving, John. I was recently reading something about how some of the so-called COVID long haulers, people who had COVID infection, but then for months and months and months afterwards, they're not really able to get better. They have a lot of ongoing symptoms related to COVID for months. Some of those patients are actually feeling better after they get vaccinated, and nobody
Hmm.
really understands the mechanism of action there. But so that's why some people get more side effects than others. But generally speaking, the side effects are very minor. They're an inconvenience at most. They can be easily treated with just Tylenol and drinking lots of fluids and maybe staying home for a day or two. But no serious side effects are common.
Right, and so for those uncommon folks, I mean, we did have someone ask a question before this about, they had received the vaccine and actually had been bedridden for a few days and had a really hard time getting out of bed. I mean, I would assume your response or your recommendation would be to, talk to your doctor and determine if it's, related to the vaccine or maybe it's even something else.
Correct. Yeah. Yeah. So, I mean, I think that, having some symptoms for 24, 48 hours is not uncommon, and those can usually be managed just by, kind of taking it easy, maybe taking some Tylenol and getting some rest. But if symptoms are more severe than that, and certainly if they're lasting for a longer period of time, then, we shouldn't assume that those symptoms are all related to the COVID vaccine. Maybe there is something going on additionally that's causing somebody to feel that way, so they should certainly reach out to their primary care doctors and get a formal evaluation.
And one of the things that pops into my head a lot of the time is I think about the flu vaccine, right, and how it's it's pretty common. You can go to your doctor, you can go, if you're at the drugstore or anything like that, you can get the flu vaccine. Whereas with the COVID vaccines, it's been a little more, regulated, or a little more like you have to stay for observation, it takes a little bit more time. Is that because it's new and we don't really know, like, we have to watch for, any instances of, major side effects, or why is that?
Yeah, I think that a lot of these, so first of all, the availability of the vaccine, I think, why can't people just go to their PCP office and get the vaccine? I think we will get there. I think that initially with the Pfizer vaccine, because of the super cold temperature storage requirements, and then there was a certain amount of reconstitution that needed to happen by a pharmacist, the vaccine rollouts were limited to places like hospitals where we had the special freezers, and we have a huge workforce of people who can get the vaccine reconstituted and ready to inject into people's arms. But I think that as vaccines such as the Johnson and Johnson and perhaps the AstraZeneca down the road come to the market, they're not as fragile as the messenger RNA vaccines, so they don't have the same super cold temperature requirements. They're just more durable, and I think those vaccines will become more widely available through conventional uh, places like doctors' offices and pharmacies, et cetera, et cetera. There was a second part of, the observation period. Yeah, I would say that, we've given over 63,000 vaccines at Nuvance, and knock on wood, we have had almost no serious side effects. And I think part of the observation is just to make sure that because it is such a new vaccine, we'd rather err on the side of caution and make everybody hang around for 15 or 30 minutes rather than, send everybody on their way and then have something untoward happen, outside of the hospital. So my expectation is that as all of our comfort levels with these vaccines increases over time, and we've got millions and millions of people being vaccinated, some of those things will go away.
And one of the things that you're seeing a lot in the news recently is a lot of questions about, from women, like, about whether or not they should get the vaccine if they want to get pregnant, or if they are pregnant, or if they're lactating or anything like that. Can you speak to that a little bit?
So this is a big area of concern, understandably, because most of the studies of these vaccine studies excluded pregnant women, as we usually do. We usually don't do clinical trials with pregnant women. But I think that we do understand that vaccination as a general rule is fairly safe during pregnancy and lactation and in women of childbearing age. In fact, anything that a woman can do to protect herself so that her baby will be as healthy as possible, because the baby can only be as healthy as the mother, I think is a beneficial thing. I think that where some of the concerns are is just the lack of data. And so I do understand those concerns, but my understanding is that most of my OBGYN colleagues feel that overall the vaccine is safe in that population of patients.
Okay, thank you. Another quick just question, as it relates to the vaccines is, because it's so new, do we know how long they're going to work? If you've been vaccinated, do you know how long you're going to stay, or the efficacy is going to last?
So no, we don't know a firm answer. I think most of the trials ended at about 3 months. So we know that it certainly lasts for 3 months. And I think we're going to need to do those continued studies to see, how long after the vaccine do we have antibodies in our bloodstream, because presence of antibody is what is necessary to confer the protection of a vaccine. So I think that as we know more about, as we do those more prolonged studies, we'll have a better sense. And then there's also the issue of the variants, right, John? So some of these early vaccines were developed against a coronavirus, which isn't now the preeminent coronavirus variant that is in our population. So for both of those reasons, meaning we don't know how long the protection lasts, we may need to re-up periodically on our shots. And number two, because the coronavirus is mutating and changing like all viruses do, the vaccines may need to keep up with the variants, and we may need to get a booster every year, just like we do for the flu shots.
Okay. And so another thing that comes up a lot of the time is people want to, they say that, well, these vaccines, actually, they're not approved. They're only, authorized for emergency use. What exactly does that mean?
So, and I'm not an expert on FDA regulations, but my understanding is that all of the to get full approval of any drug is a sort of long, convoluted process that requires many, many steps. But there are some critical steps, particularly related around safety and efficacy of a vaccine or drug, that are able to be quickly reviewed by the appropriate people. And then a medication or a vaccine, in this case, is granted that emergency use authorization, which means that all of the critical things that we need to know about that drug have been reviewed, are felt to be satisfactory, to the point where we feel, yes, we can safely start using this. And then I think down the road, it will no longer be authorized for use under a EUA. It'll go through its formal approval policy, process, and at which time it'll just be approved.
I gotcha. Okay. And so I've been vaccinated, and I got my second shot. What does that mean? Like, can I start traveling? Can I go see family? Like, what can I do once I'm fully immunized?
So, once somebody is fully immunized, which generally means for the Pfizer and Moderna, you've had both of your shots and you're at least 2 weeks post your second shot 14 days after your second shot. And I think for Johnson & Johnson, it's 14 days out of your initial and only shot. Then you are considered to be fully immunized, meaning we think that your body has sufficient levels of antibody to the coronavirus spike protein so that if you were to encounter the coronavirus, your body will quickly find it, it will quickly identify it and neutralize it. And the question about what does that mean in terms of resumption of normal activities is still sort of being defined. I think that there is some guidance out there saying that groups of fully vaccinated people can small groups of fully vaccinated people can probably get together for social gatherings, dinners at home, visiting grandparents and things like that. In terms of travel, I don't think that there's anybody sort of out there saying, yes, go ahead and travel is perfectly safe, because that's probably not something we want to be doing right now, given that our numbers are still on the rise and there are all these variants. But at some point, we will see whether people who are fully vaccinated are a little more free to go out to dinners, to restaurants, to get on a plane, to go on a cruise. I don't think we know all the answers there, but my assumption would be that yes, eventually there will be some form of a COVID vaccination passport that you'll have to show in order to be able to do certain social activities.
Gotcha. So until then, you got to keep doing the stuff that you've been doing, and in lots of ways, it's as it always has been. You wear the mask not just to protect yourself, but to protect others, right? So continue to do those types of things. Yeah.
Absolutely. So, being vaccinated is not a get out of jail free card. You still have to do all of those things, which are so important and which we know work, right? So wearing a mask when you're around others, keeping your social distance, hand washing, those are the pillars of our success. And so I don't think that vaccination obviates the need for those things. That will continue.
Right, and so this illness is, it affects everyone. It affects lots of different populations, lots of different races and age groups and all this stuff. So now that eligibility is opening up, across Connecticut, across New York, for pretty much all the age groups, I'm assuming it's your recommendation that everyone who is eligible to get out there and get vaccinated, correct?
Absolutely. I mean, I think we're all in this together. I don't think we've ever been in something as much as this together, and none of us is safe until we're all safe. And so I think that as the vaccine becomes available, as the eligibility criteria get modified, and there's new evidence to suggest that Pfizer, we now know that 16 and over can be vaccinated with the Pfizer vaccine. There's some new data coming out about 12 to 15-year-olds, and I think those numbers will continue to go down further in age group. But my strong recommendation would be that anybody who has access to a vaccine should absolutely go and get a vaccine if one is available to them. And I think our goal as healthcare providers will be to get the vaccine to every single person in our country who wants a vaccine in a way that is easy and convenient and safe for them.
Okay, and we've been talking about the different types today, the different types of vaccines. So I asked you this question before we started today. I'm going to ask it to you again. What's the best vaccine for me to get? Like if I go somewhere, should I be requesting a specific kind of vaccine, or what's the best one for me to get?
So, John, I think the best vaccine to get is the one that's in front of you, that's about to be jabbed into your arm. That is the best vaccine to get. And, we do know that all three of the currently approved vaccines have very, very similar efficacies. There are very small differences amongst them. So I would say whatever vaccine is in front of you, that's the vaccine to get.
I love it. And so I'm going to put your prognosticator hat on just for a second. And, again, this is idealism, it's not any factual, but like where do you hope we are like a year from now? You know, in terms of this, you know, are we still, you know, battling this? Is it like, do we have herd immunity? And like, what will the vaccines lead us as a society? You know, will we be able to get back to normal?
You know, that certainly is the hope, John, is that these vaccines will, if enough people get vaccinated, and there's this whole concept of herd immunity, right, where enough of us, 75% or so of us have been vaccinated and therefore have immunity against the virus, then it sort of inhibits the virus's ability to just, replicate amongst us at warp speeds. So once that happens, then I think, yes, children go back to school. We start having our family gatherings. Hopefully one day we'll be able to start traveling to see, loved ones or go to conferences, go out to restaurants. My hope would be that once we have achieved that level of herd immunity and have some sort of protocol for getting a booster whenever that's necessary to maintain our immunity, that life can resume to some semblance of our pre-COVID lives. It may not be, we may not ever have the full freedom, or not for a while anyway, to do all the things that we used to do, like, filling theater, going to big concerts with 50,000 people and football games and those kinds of things. My hope would be that we can get there someday. That may come a little bit later, but I think for most of us, what matters is seeing our parents, seeing our grandparents, being able to hang out with our friends once in a while. Those are the things that really we've all suffered from the loss of. So my hope would be that in a year, we would be at least back to that level.
Absolutely. Yeah, I think that's all of our hope. And I will say just to everyone who's watching that, if you are eligible and you need more information, you can visit our website, newvancehealth.org. We have great FAQs. We have lots of information about, to answer questions. Other places you can visit are like the Centers for Disease Control website. Your state websites have information, as well as your counties. If you're someone who's eligible and needs an appointment, there are a lot of different places that you can go to. I usually recommend people start with vaccinefinder.org. That kind of shows you all the places locally that have the vaccine and give you links to where you can find an appointment. So I will, close today with just asking you, well, actually, we do have a question that came in, and it was from someone who says they had a, kind of a negative reaction to their first dose of Moderna, and they were wondering, is it possible, or is it safe, or do we know for them to get, start over, to get a different vaccine if they had a negative reaction to one of the others?
So that's a great question, and I would say that we don't have the full answer to that right now. Probably sometime over the next many months, we will have a better sense of whether it is safe and possibly even better to mix and match different vaccines. There's certainly some literature out there to support that. But given that currently we still have access issues and availability issues, we don't have enough vaccine yet for everybody, I would encourage people to stick with whatever they've started with, because we want to make sure that everybody gets a chance to get at least a vaccine. So I would say if you started with the Moderna, then you should continue with the Moderna, and hopefully your side effects will not preclude you from being able to do that.
Okay. And I'll just close today with asking you, like if you had a family member or a patient or someone who came to you and they were kind of on the fence, they weren't sure, they kind of wanted to wait and see or anything like that. I'm not saying like what would you say to convince them, because it's a personal choice, but like what would be your kind of message to this person about whether or not they should get immunized for COVID?
So my message would be that while, yes, there isn't a lot that we know specifically about COVID vaccines. Vaccinations have been around for 100 years or more, so we do know a lot about vaccinations in general. Um, while I don't know a lot about the COVID vaccines, I do know a lot about COVID. As the VPMA of Danbury Hospital, I oversaw our COVID efforts. And COVID is a terrible disease. And there are some people who are very young and have no comorbidities who really get severely ill or possibly even die. So I would say trust the science, believe in the science. It's real. And we are in this amazing place where we now have the possibility of saving lives with a relatively simple, harmless intervention. So what I would say to everybody is, don't take your chances with COVID, take your chances with the vaccine. This is the safest and easiest and most effective way that we're going to keep ourselves safe, our families safe, each other safe, and get back, hopefully, to our more normal lives.
That was so well stated, and thank you so much for joining us today, Dr. Oltikar. Have a wonderful day, and thanks to everyone for joining us for 30 minutes to talk about COVID vaccines. Thank you.
Thank you, John. Bye-bye.